Today I want to discuss the hot topic, testosterone. Now, a lot of people come to me and they say, I want a total testosterone of 1200. Okay, so this shows me that there's a little bit lack of education here. Now, when you have a total testosterone, I want you to think of the total amount of testosterone that's in your body. Now, there's two things that are very important here. They're called proteins, albumin and sex hormone binding globulin, also nicknamed the SHBG. The SHBG is the bigger monster of the two. Now, these proteins will bind to your total testosterone, making that testosterone unusable for your body. What that means is the real testosterone that you can actually utilize is called the free testosterone. Now, you can have a 1200 total testosterone, but if your SHBG is elevated, you will have a low free T, which means that your testosterone that you can utilize is still low. So that's something to keep in mind. Something else to keep in mind is the things that we need to monitor to make sure that your testosterone replacement therapy is keeping you safe. One of the biggest ones is your hematocrit. This is the thickness of your blood. Sometimes with testosterone therapy, your hematocrit can rise. What that means is it increases your risk for clots. And if you have an increased risk for clots, that means you have an increased risk for heart attack, stroke, and pulmonary embolism. And I promise you, no level of testosterone is worth those three risk factors. Something else to keep in mind is monitoring what's called the PSA, your prostate-specific antigen. Now, the importance of this is because testosterone cannot cause prostate cancer, but it can in fact make prostate cancer, if it is already existing, it can make it worse. So that's something to kind of keep in track when you're monitoring your testosterone therapy. Something else to keep in mind is blood pressure. If you have hypertension, testosterone replacement therapy can make that worse. Something else that testosterone can also make worse is your obstructive sleep apnea, if you already have it. Now, these are all really important things, and if you're taking testosterone without monitoring them, you're at high risk for a lot of issues. Something that people don't realize is the goal of testosterone therapy is to optimize you, but also keep you safe. Here at BioRestore, we monitor your labs every 3 months to make sure that you are within the normal range of testosterone, that your PSA is not elevated, that your hematocrit isn't getting too high, and that you've maintained a solid regimen where your blood pressure is controlled and you feel healthy. At the end of the day, that is always our goal. Keep you safe, keep you optimized.